So you've been told you have type 1 von Willebrand disease. First thing you need to know is that you're not alone. Type 1 VWD is an inherited bleeding disorder that affects around 1 in every 100 people. It's a condition that increases the tendency to bleed, particularly after an injury or surgery. Not everyone gets bleeds, but some people will get nosebleeds, mouth or gum bleeds. They may bruise more easily, and women may find they bleed more or for longer during their periods. So what's the cause of this bleeding? Well, it's about clotting and fishing rods and sheds. Pay attention. When you have a cut, you'll know that the blood usually forms a clot or scab over the cut. This is because of cells called platelets that normally flow through your blood vessels. When there's a break in the wall of a blood vessel and blood leaks out, platelets collect around the break and become activated, changing their shape and forming a kind of plug that blocks the break. But those platelets need to be brought to the cut and to be kept there. This is where von Willebrand Factor comes in, and fibrin. Let's imagine that platelets are like fish swimming in a river. Von Willebrand Factor acts like a fishing rod, hooking up the platelets and bringing them to shore where there is a leak in the riverbank. Fibrin works like a fishing net that's put down near the leak to get all the fish together so that they block the leak. People with VWD have low stores of von Willebrand Factor. In other words, very few fishing rods, and they're usually kept locked up in a shed, which means there aren't enough fishing rods at the riverside, and so not enough fish can be caught and reeled into shore to block the leak. So, the water continues to flow out. People with type 1 VWD may be given medicines to help manage bleeding. One example of medicine is Desmopressin, also known as DDAVP. These medicines act like a key that unlocks the shed to allow more fishing rods to be used at the riverside. So, while they can help to promote the release of the small amount of von Willebrand Factor, there are only a few fishing rods in that shed. DDAVP can be used for up to 3 consecutive days. After this time, the fishing rod sheds need to be restocked. It takes time for the body to make more von Willebrand Factor. In a few cases, such as if you need surgery, you might be treated with an infusion of von Willebrand Factor because you need more fishing rods. Another treatment you may receive is Tranexamic Acid, which usually comes in tablet form. Tranexamic Acid helps to stop clots from breaking down, so it reinforces the fibrin mesh fishing net. While living with type 1 VWD can cause some issues, it need not restrict you too much. With the right treatment and support from your specialist team, your condition can be well managed, so you can look forward to a healthy and fulfilling life.